You're doing everything right. You've cut back on salt, you're trying to eat better, you take your medications as prescribed, and you may even walk most days. When you check your blood pressure, the numbers are still higher than they should be. If that sounds familiar, this video is for you. This is not about fear, and it's not about blaming you or your doctor. It's about awareness. Because after age 60, blood pressure is often influenced by factors that rarely get explained. Things that feel harmless, routine, or completely unrelated to the heart. In this video, we're going to uncover 5 hidden triggers that quietly push blood pressure higher in seniors, even when lifestyle and medication seem right. And stay with me, because midway through the video, I'll reveal one everyday factor that affects millions of older adults and is one of the most overlooked reasons blood pressure refuses to come down. Understanding these triggers can give you back control, clarity, and confidence, so you can protect not just your heart, but your independence too. Why BP gets harder to control after 60. Many people feel frustrated when their blood pressure becomes harder to control after 60, even though they haven't changed much about their lifestyle. They may still eat carefully, stay active, and take medications as prescribed, yet the numbers stay high. This isn't because they're failing, it's because the body changes with age, and those changes directly affect blood pressure. One of the biggest changes happens in the blood vessels. As we age, arteries naturally become stiffer and less flexible. In younger years, blood vessels expand and relax easily with each heartbeat. Over time, that flexibility decreases. When arteries stiffen, blood has less room to flow smoothly, which raises pressure inside the vessel walls. This means the heart has to work harder to push blood through the body, even when you're resting. The kidneys also play a major role. Their job is to regulate fluid and salt levels in the body. After 60, kidney function gradually declines, even in people without kidney disease. This makes it harder for the body to handle excess sodium and fluid. As a result, small dietary choices or medications that didn't affect you years ago can now cause noticeable blood pressure increases. Another key factor is increased sensitivity. Aging bodies respond more strongly to stress, poor sleep, dehydration, certain foods, and medications. Triggers that once caused a small temporary rise in blood pressure can now lead to sustained elevation. This is why blood pressure can become unpredictable or resistant to treatment. This is also why old advice sometimes stops working. General tips like just cut salt or exercise more are still helpful, but they may no longer be enough on their own. Blood pressure after 60 is influenced by multiple systems working together: vessels, kidneys, hormones, sleep patterns, and nervous system balance. Understanding this shift is empowering. It explains why blood pressure becomes more complex with age and why a more complete approach, beyond just diet and medication, is often needed. Awareness helps you stop blaming yourself and start addressing the real reasons blood pressure control becomes more challenging later in life. Sleep and nighttime BP spikes. Many seniors focus on what they do during the day to control blood pressure, but what happens at night can be just as important, sometimes even more so. One of the most overlooked causes of stubborn high blood pressure is poor sleep, especially undiagnosed sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. Each time this happens, oxygen levels drop and the body reacts as if it's in danger. The brain sends out stress signals, adrenaline is released, the heart rate jumps, blood vessels tighten, and blood pressure spikes. This can happen dozens or even hundreds of times in a single night, often without the person fully waking up or remembering it. Over time, these repeated nighttime stress responses train the body to keep blood pressure elevated around the clock. This is why sleep apnea is strongly linked to resistant hypertension, meaning blood pressure that stays high despite medication. In these cases, adding more medication may not fix the problem because the trigger is happening during sleep. The challenge is that symptoms are easy to miss. Many seniors assume loud snoring, daytime fatigue, morning headaches, dry mouth, poor concentration, or frequent nighttime awakenings are just part of aging. But these can be warning signs that the body is struggling to breathe properly during sleep. As we age, sleep apnea becomes more common. Throat muscles lose tone, sleep becomes lighter, and other health conditions increase airway collapse risk. Even people who never had sleep problems earlier in life can develop apnea later on. The good news is that sleep apnea can be identified and treated. Simple sleep studies, often done at home, can reveal what's happening overnight. Treatments like CPAP therapy help keep the airway open, improving oxygen levels and often leading to better blood pressure control, more energy, and clearer thinking within weeks. Healthy sleep isn't a luxury, it's a critical part of blood pressure regulation. If sleep is disrupted night after night, medications alone may never be enough. Loneliness, stress, and daily rhythm. High blood pressure is often treated as a purely physical problem, but the body doesn't separate emotions from physiology. Emotional stress directly affects blood pressure, especially after age 60. Loneliness, social isolation, and lack of daily structure may not feel medical, but the body interprets them as ongoing stress, and the heart responds accordingly. When a person feels isolated or disconnected, the brain releases stress hormones like cortisol and adrenaline. These hormones cause blood vessels to tighten, heart rate to rise, and blood pressure to increase. If this stress becomes chronic, which is common in older adults who spend more time alone, blood pressure can remain elevated even when diet and medications are in place. Research consistently shows that seniors who experience ongoing loneliness tend to have higher systolic blood pressure over time. Another overlooked factor is daily rhythm, also known as the circadian rhythm. In a healthy pattern, blood pressure naturally dips at night during sleep and rises gently in the morning. This nighttime drop is important. It gives the heart and blood vessels a chance to rest. But when daily routines become irregular, this pattern can break down. For many seniors, retirement, loss of routine, or disrupted sleep schedules lead to staying up late, sleeping in, skipping meals, or spending long periods indoors. When the body loses consistent signals, light exposure, meal timing, movement, it can develop what's called non-dipping blood pressure, where levels stay high even at night. Non-dipping BP is strongly linked to higher risks of heart attack, stroke, and kidney disease. The good news is that small, simple structure makes a big difference. You don't need a busy schedule. Start with 1 or 2 anchors each day. Wake up at the same time each morning. Eat meals at consistent times. Get daylight exposure. Even a 10-minute walk or sitting near a window helps reset the body clock. Gentle daily movement also stabilizes stress hormones. Connection matters too. A phone call, a short visit, a community group, or a senior center activity can lower stress responses in the body. These are not just emotional benefits, they are heart protective behaviors. Blood pressure responds to rhythm and connection. When days regain structure and meaning, the cardiovascular system often follows. Medications that quietly raise BP. Many seniors are surprised to learn that some of the biggest blood pressure triggers aren't foods or stress, but common medications, especially over-the-counter ones. These medications are widely used, easy to access, and often taken without a second thought. But after 60, the body becomes more sensitive to their effects. One major group is non-steroidal anti-inflammatory drugs, such as ibuprofen, naproxen, and similar pain relievers. These drugs are commonly used for arthritis, joint pain, and back pain. While effective, non-steroidal anti-inflammatory drugs can cause the body to retain fluid and reduce kidney function. This increases blood volume, which raises blood pressure. In people who already have hypertension, even moderate daily use can quietly push numbers higher over time. Another hidden trigger is decongestants, often found in cold and allergy medications. Ingredients like pseudoephedrine work by narrowing blood vessels to relieve nasal congestion. Unfortunately, this same action raises blood pressure throughout the entire body. Seniors are especially sensitive to this effect, and repeated use can significantly interfere with BP control. Even antacids and heartburn remedies can play a role. Some contain high amounts of sodium, which leads to water retention and increased blood pressure. Because these products are marketed for digestive comfort, many people never think to check their sodium content. The biggest problem is awareness. Over-the-counter medications don't require prescriptions, so they're often left out of medical conversations. Many people assume that if something is sold without a prescription, it must be safe. But OTC does not mean risk-free, especially for older adults managing blood pressure. This doesn't mean you must avoid these medications completely. It means they should be used thoughtfully and discussed with your doctor. Knowing what you take and how it affects your body can remove a major hidden obstacle to blood pressure control. Awareness here often leads to improvement without adding any new medication at all. Healthy foods that sabotage blood pressure. Many seniors are shocked to learn that some of the foods they eat every day, foods they believe are healthy, can quietly raise blood pressure. This happens not because you're making bad choices, but because hidden sodium and added sugars are built into many modern foods, even those marketed as heart healthy. Let's start with sodium. Most people think sodium only comes from salty snacks or adding salt at the table. In reality, over 70% of sodium comes from packaged and processed foods, not from the salt shaker. Bread, breakfast cereal, canned vegetables, deli meats, frozen meals, soups, veggie burgers, and even low fat or heart healthy products often contain far more sodium than expected. You may not taste it, but your blood vessels feel it. Sodium causes the body to hold onto water. That extra fluid increases blood volume, which raises pressure inside your arteries. After age 60, the kidneys are less efficient at removing excess sodium, so the same foods you tolerated years ago can now push blood pressure higher. This is why blood pressure may rise even when you believe you're eating carefully. Added sugar is another hidden problem. Many seniors don't connect sugar with blood pressure, but research shows diets high in added sugar can raise BP by increasing insulin levels, promoting inflammation, and damaging the lining of blood vessels. Over time, this leads to stiffer arteries and higher resistance to blood flow. The tricky part is where sugar hides. Foods like flavored yogurt, granola bars, breakfast cereals, instant oatmeal, salad dressings, pasta sauces, and healthy snack bars often contain significant added sugar. Some low fat products replace fat with sugar to improve taste, which quietly harms blood pressure control. This doesn't mean you need a perfect diet, it means you need label awareness. For sodium, a helpful guideline is choosing foods with 140 milligrams or less per serving when possible. Be cautious with words like seasoned, broth, instant, cured, or flavored. These often signal added sodium. For sugar, watch for ingredients ending in O's like sucrose or dextrose, and syrups such as high fructose corn syrup or fruit juice concentrate. Small changes matter. Swapping packaged foods for more whole foods, choosing lower sodium options, and reducing sweetened items can lead to real improvements in blood pressure. Many seniors see better readings not by eating less, but by eating smarter. Alcohol and supplements. After 60, alcohol and supplements are often overlooked when blood pressure refuses to improve. Many people assume that moderate drinking or natural supplements are harmless, or even beneficial. But after age 60, the body handles these substances very differently, and their effects on blood pressure can be stronger than expected. Alcohol raises blood pressure by increasing heart rate, narrowing blood vessels, and triggering hormonal responses that elevate pressure. While younger bodies may tolerate alcohol better, aging changes liver function, blood volume, and medication sensitivity. This means that even small, irregular amounts of alcohol can have a larger impact on blood pressure in seniors. A glass of wine with dinner, a few beers on the weekend, or a nightly drink to relax may not seem like much. But over time, this routine can keep blood pressure elevated, especially when combined with blood pressure medications, sleep medications, or heart drugs. Alcohol can also interfere with how medications are absorbed and processed, making them less effective or increasing side effects. Supplements present another hidden challenge. Many are marketed as natural, heart-friendly, or energy-boosting, which creates a sense of safety. But supplements are not regulated as strictly as medications, and dosages may vary widely. Some ingredients can directly raise blood pressure or interfere with prescriptions. Common examples include licorice root, which can raise blood pressure by affecting hormone balance, ginseng, which may stimulate the nervous system, and yohimbine, which can increase heart rate and pressure. Even certain relaxation or energy blends may contain stimulants that push blood pressure higher without clear warnings. The danger usually isn't a single drink or a single supplement. It's the steady, repeated exposure over weeks and months. Combined with aging kidneys, medications, and existing hypertension, these substances can quietly undo other healthy efforts. This doesn't mean alcohol or supplements must be avoided completely. It means they should be used thoughtfully and discussed openly with your doctor. Everything you consume sends signals to your cardiovascular system. After 60, awareness becomes one of the most powerful tools you have to protect your heart, your stability, and your independence. Simple BP control plan. Controlling blood pressure after 60 doesn't require perfection, complicated routines, or constant worry. It requires consistency, awareness, and small, smart actions done regularly. A simple plan can often make a bigger difference than adding another medication. Start with what to check weekly, not obsessively. If you have a home blood pressure monitor, check your BP at the same times each week. Ideally, once in the morning and once in the evening on 2 or 3 different days. Sit quietly for a few minutes, keep your feet flat on the floor, and rest your arm at heart level. Write the numbers down. Patterns matter more than a single reading. This helps you and your doctor see whether your pressure is stable, rising, or improving. Also, pay attention to how you feel, not just the numbers. Notice symptoms like dizziness, fatigue, headaches, poor sleep, swelling in the legs, or feeling lightheaded when standing. These clues often point to triggers like medication effects, poor sleep, dehydration, or stress, things numbers alone don't explain. Next, know what to ask your doctor. Bring a full list of everything you take, including over the counter pain relievers, cold medicines, supplements, and alcohol habits. Ask simple, direct questions. Could any of these be raising my blood pressure? Is this dose still right for my age? Do I need all of these medications? Could sleep, stress, or timing be affecting my readings? These questions shift the focus from adding more treatment to improving what's already in place. Now focus on small, consistent changes. Improve sleep routines. Create a regular daily schedule. Reduce hidden sodium and added sugars. Be cautious with alcohol and supplements. Review medications regularly. You don't need to change everything at once. Choose one area, work on it for a few weeks, then move to the next. Consistency is far more powerful than intensity. Many seniors find that when these pieces come together, blood pressure becomes easier to manage and they feel better overall. More energy, better sleep, clearer thinking, fewer surprises on the BP monitor. This is what sustainable control looks like. If you remember one thing from this video, let it be this. Blood pressure control is not about being perfect. It's about being aware. High blood pressure doesn't usually come from one big mistake. It comes from small, hidden factors adding up over time. And the good news is, once you see them, you can change them. Awareness beats fear every time. When you understand how sleep, stress, medications, food choices, alcohol, and daily routines affect your blood pressure, you regain control. You stop guessing, you stop blaming yourself, and you start making informed decisions that support your heart and your independence. Small changes done consistently can lead to meaningful improvements, not just in your numbers, but in how you feel day to day. Stronger, steadier, more confident. If this video helped you see blood pressure in a new way, give it a like so others can find it too. And subscribe for clear, senior-focused health guidance every week. In the comments below, share one small change you're willing to try. Your step forward might inspire someone else to take theirs.